Welcome to the Wellness in Asheville Podcast, where we shine a light on the people, practices, and places that make this city one of the most inspiring wellness communities in the country. I'm your host, Travis Richardson, founder of Be Well Asheville, your local news source for health, wellness, and community events. Today's guest is Dr. James Pinkston, a regenerative medicine physician and owner of Asheville Non-Surgical Orthopedics. Dr. Pinkston helps patients harness their body's innate ability to heal using cutting-edge therapies like PRP, stem cell injections, and shockwave therapy to address musculoskeletal pain and dysfunction without surgery. His philosophy is simple: keep people strong, active, and living the life that they love at every age. So we have Dr. Pinkston on the show. This is our second time. This is really exciting for me. There's a reason why I'm having him back on the show. That's because I loved the first episode that we did, and I couldn't wait to have him back on. So welcome to the show, Dr. Pinkston.
Thanks so much. I imagine it'll be a pleasure again.
Yeah, so I continue to love what you're doing over there. Your business, Asheville Non-Surgical Orthopedics and Regenerative Medicine, and that is really in alignment, of course, with what we do or what I'm trying to do with this longevity series here. So we begin where we always do, which is the story of what drew you to this practice. And so for those of listeners out there that didn't hear the first episode, apologies to have you repeat yourself here, but what drew you to regenerative medicine, and what does non-surgical orthopedics actually mean for those who haven't heard that term before?
I can summarize it pretty quickly. A child, young, impressionable child, looking at things like the action figures of the day, Arnold Schwarzenegger, having a fascination with anatomy, pursuing that, having the influence of my mother, who is a extreme caregiver of 4 children, and going into healthcare fields. So personal training, athletic training, leading to medical school. And in medical school, ultimately focusing on what I do now, neuromusculoskeletal medicine. And the field that I am practicing in really is orthopedics, but the non-surgical variety of that, which means really treating any orthopedic condition with something other than surgery. And that could be the standard treatment that you might think of, like steroid injections or physical therapy. Physical therapy is amazing. It's a big part of how I help patients, but also things that aren't part of your typical medical practice, like regenerative medicine. And that's really where I have expanded my services. That's the main thing that I focus on. And in a nutshell, that's just things you can do to get the body to heal itself. And there's a number of treatments in that category, from various energies, sound energy like shockwave, laser, magnetic, and a lot of injections from really taken from the person. I call those biologic injections, cellular therapy. So a little bit different perspective.
Yeah, and it's when you think about injections, it's a breath of fresh air, honestly, to me, when I think about taking components of my own body and just using those to stimulate growth factors and some of the other things that you talk about to induce healing. We'll talk about some of those here on the show. But before we do, I guess I imagine like the kind of person that comes to see you, like me, when I first met you, I was really frustrated with some of the conventional approaches. And everything has their place. So I'm somebody who really believes that finding the right technique or modality is the thing, but not to dismiss all of them. But who is your typical patient that you see, and what are they what are they usually, I guess, what are common frustrations that people might have when they come see you?
Frustration is a pretty good
Mm,
description. We often see patients who've seen a lot of other providers. They've tried a lot of different treatments and they're really getting fed up. And then they find our practice, something to them seems much more alternative. And they're frustrated because there's something that they want to do or they're afraid that they won't be able to do in the future. Now, it's it's not always some grand competition, although sometimes it is. We've had a marathon runner very uh, upset because they couldn't practice the way they want. They couldn't compete, and with some treatment to Achilles, plantar fascia, shock laser, not only were they able to compete, they were able to win at least their age category, but not only that, the one below it. So they did really great. And there's also very simple things like a grandpa, first time grandpa, and he had gotten to the point with his knees that he was having extreme difficulty getting up and down off of
mm.
the floor. It was really mostly bending. There was some pain, but the range of motion was limited. And they wanted to be able to play on the floor with their grandkid. So we did some cellular therapy with them. In this case, some fat. And we may talk a little bit more about that. And
Hmm.
much better. Not totally resolved, but good enough. Pain under control, range of motion nearly normal so that they could now get down on the floor, play with their grandkid and get back up. So little victories like that uh, mean a lot to us. And that's really our goal, kind of define what the patient is looking for and see what tools we have in our belt to help them out.
Yeah, I think that mobility I was listening to a podcast. I don't remember who was talking about it, but the way they framed up longevity was is that how well can you move in your older ages? Because if you can move well in your older ages, in older age, you probably are going to have the kind of muscle that it's going to require to keep your blood sugar down and intact. You're going to move your lymph system. It requires movement, so you're going to have that be. You're going to be circulating lymph better. Um, you're going to be putting out lots of healing hormones. So I think that when it comes to longevity, making sure that you stay mobile so that you can have and do the kinds of exercises that are needed as you go along are important. So, how do you frame sort of your philosophy behind keeping people healthy as they age? I know you and I talked about frailty and sarcopenia and those kinds of things. So, I guess what's your overall philosophy behind uh, keeping people active? Like, how does that show up for you in the practice?
One of my soapboxes that I'll inevitably get on is talking to people about staying strong and active. Those are the two words that I use. I say that's the secret to aging gracefully. And one of the bigger priorities for me to get across and communicate to patients is muscle mass and strength and maintaining or improving really at any age. So I spend a great deal of time talking about strength training. And that doesn't have to be necessarily with weights or at a gym. There's all sorts of varieties of that. But bottom line, building and maintaining strength. So you maintain independence. You can still do everything you want to do. And you don't have to rely on others, or you don't lose the the activities that you once enjoyed. And just from a pain perspective, which of course is really big in my practice, really the stronger a joint, usually the more stable. usually the less pain. And even if it's not because of stability, just contracting muscles release proteins into the bloodstream that help with pain and inflammation. So it
Say that
can't be
again.
understated.
You said contracting muscle releases proteins that reduce. Did you say reduce inflammation? I've never heard that. That's really interesting to me. That's super important to know. Say that again.
Yeah, that help control pain and inflammation. So any form of strength training anywhere, really. So if you have leg pain, we're just working your arms will help to a degree with that. It's not going to fix it. And it's also important to realize on the other end of things, being sedentary and having more, in this case, fat cells, adipocytes, they release signals and proteins into the bloodstream that promote inflammation, which typically leads to pain in a lot of people.
Yeah, interesting. One of the things I really appreciated in working with you, and I was the times I've been in to talk to you about my pain and what I'm going through. Lots of people know about my my neck issues. Is the additional talk around all these other things, and I really appreciated that. So I think that's one of the things I really loved about coming in. Now, let's move on to stem cells, because I think there's a lot of confusion around these. I don't really even hear, honestly, I don't hear a lot about stem cells. Like there was like a time where stem cells were in the news a lot. And I think it became pretty much into the mainstream's consciousness to know what a stem cell was with it. But there's a lot of confusion. So what are stem cell therapies, and what are they actually doing inside the body?
The term stem cell, at least as it's used now, is really just a grab bag term. It's applied to many things, doesn't necessarily mean something specifically. And yeah, it's even been in the news cautioning people against treatments like that because of certain bad actors. And what stem cell could mean when people are using it, it could mean some sort of birth tissue product like amniotic fluid or umbilical fluid, which don't have living cells in them, but a lot of proteins and signaling molecules. And that's really kind of how it all works, is the signaling within the body. Some people even call blood products platelet-rich plasma stem cell. None of those really have stem cells in them. In the United States, the two treatments that are actually stem cells would be tissues that have mesenchymal stem cells. That would be the classification, mesenchymal stem cells. And that is bone marrow and fat. Those are the two that are approved. So everyone has something that comes to mind when they hear the term, but it's not embryonic. It's not the birth tissue products or the blood product. In the U.S., it's either fat or bone marrow.
Yeah, so because for me, I always used to think it's really, for some reason, this idea of signaling as a signaling mechanism to help instruct and tell your body what to do better, basically, is I always think, because I always used to think of stem cells as they're going to grow something new. They're doing something. They themselves are growing new tissue, but it's not necessarily them that is doing that. They're acting as a signaling, sort of like a traffic cop that is waving and telling what should happen next inside the body. So that's an interesting.
That's right. That's a common misconception. They think, okay, put these stem cells in, they go become the new tissue I'm lacking, say cartilage cells or a torn tendon or something. And to a degree, there seems to be some of that. But the real effect seems to be what those stem cells release into the area, the environment they create. And they're just recruiting your inflammatory system, your immune system to come to the area and try to heal.
This is when I do these kinds of these podcast recordings, I like to kind of keep a flow and talk, ask sort of sequential questions. But this one here makes me think, and this is just me wondering. All right, I'm going to just say that it seems to be like a stem cell is a smarter form of a cell that has not lost its intelligence on what to do next. So it seems to me that, maybe as we age, that the cells lose their ability to be smart about what they should be doing. I mean, we know that like there's the senescent cells, which are zombie cells, essentially have lost the idea that they should. They're just no longer functioning like they used to when they were younger. Let's call it. So, is a stem cell just a?
Stay with us. We'll be right back.
Hey, quick break before we jump back in. If you're enjoying this conversation and want to go deeper, I want to give you something. We put together a free download with exclusive discounts from all of our season 1 wellness experts. Places like Drip Sauna, Asheville Salt Cave, Still Point Wellness, and lots of others. Real discounts from real local practitioners and here in Asheville, completely free just for being a listener. And here's the thing. Once you grab it, you are going to get to be first to know about some pretty exciting things that we have coming up, including a brand new longevity course we are building specifically for this community. And I think you're just going to love it. Just head over to bewellasheville.com/podcast. Check this episode's show notes, and inside will be a link to grab your discounts. Now let's get back to the conversation. Smarter, younger cell. Do you know where I'm coming from? I'm a layman here, but I'm like, this is how I'm thinking of them.
Yeah, I would call it a more capable cell. So they are tissues that can differentiate. In this case, they can really, mesenchymal cells can only differentiate into musculoskeletal tissue. And normally in the body, yes, that's what they do. They do become the new tissue that you're looking for. But when harvested and injected, they're just more of like a director, a conductor. And yes, there's a bit of a innate intelligence that's pretty miraculous, that it knows how to address the different pathological conditions, whether it be tendinitis, arthritis, neuropathy, all sorts of things. The body just does know and is capable of how to heal itself.
When we had our pre-interview call, we talked about, and you introduced me to a new concept called, it had the word dysfunction in it. And I remember us talking about that. And the way that came up was that I was asking about somehow, and I think you made mention that there's times where you could have two different patients coming in with very similar presentations, structural, maybe they both have structural damage, and one is in dire straits, pain, ready for surgery, and another person's not that bad off, but yet you look on a X-ray or something, and you wouldn't be able to tell the difference. And so pain doesn't always map to what you see on an X-ray. And then you talked about this idea of dysfunction. I think this may be like a dysfunctional cellular environment or something like that. What are you talking? Well, can you talk more about that?
Yeah, I can. You're right in pointing out, for one, differences in people, their presentations, how they respond to treatment, and health status. And a lot of that boils down to the environment that we'll just talk about a joint to make it easier. So the environment that joint is in, the environment of the inside of the joint, inside the synovial membrane. There's fluid floating around, and there's proteins floating around. There's cells in the area. It all has a function. It all has a goal, an action that it should produce. And there's various states of that. There is what you would like, a normal, healthy, state of homeostasis where everything is as it should be. And then there are what I often see is inflammatory states, which is totally different. And you were hinting at imaging not being able to predict people's pain. Absolutely. There's not very much correlation at all between, let's say, the degree of arthritis seen on imaging and the symptoms that that produces in the person. Really, it seems to be due to the environment, how everything is functioning within the joint. And if it's in that chronic inflammatory state, tends to be a lot of pain, dysfunction versus more of a healthy, relatively pain-free state.
Okay, so yeah, so what that is for me is that's a bit of a message of hope, because what it means is that maybe somebody is coming in, they're saying, look, I've got bone on bone, man. I don't think you can help me, or I've been told by everybody that I got to get surgery, and it might be that they do need surgery. It may be. I'm not saying it's not. For some percentage of those, my guess would be that if they can do all the things, let's say, improve their have improved their nutrition, maybe, try to reduce inflammation through, not eating lots of bad stuff, maybe reduce alcohol consumption if that's a big a problem, not a problem, something that would be beneficial, and then come get some treatment that would help reorganize and make that environment better. Then you may have somebody who does have bone on bone, where they can function much better than they were before, prior to having a disorganized system. I guess what I'm saying is that it feels like everyone could be a candidate to be helped. You'd have to see how
That's
it goes.
true. There's plenty of reason to be hopeful, almost regardless of what imaging says. Yes, some cases are certainly surgical, but even really severe end-stage arthritis can have excellent results with the things you mentioned, which is lifestyle modification, living in a healthy manner, what you eat, drink, activity level, and a procedure in the regenerative space, whether it be a cellular procedure, platelet-rich plasma, etc. Those things together, they can really just change function. And that can often lead to what they're looking for, which isn't necessarily a brand new joint. People want to feel better and they want to be able to do the activities they love.
Right. Tell me about PRP, platelet-rich plasma. I had that done. I know you do a lot of it. Tell me about that. Like, who gets that, and what for? What are the kind of conditions that you use that for? Platelet-rich plasma.
Platelet-rich plasma is a blood product, which means you draw some of a patient's blood, you spin it to separate out the platelets, and you inject mostly the platelets just in a little bit of plasma, which makes it platelet-rich plasma. So basically, you're taking what's in your bloodstream, concentrating it, and injecting that into the person, because those platelets contain a great deal of the signals that we're talking about. They're proteins, and when they are injected into an area, they release them and they create the signal that you're looking for, a much stronger signal for healing than typically happens just with injury, because that does happen with injury, but with something like platelet-rich plasma, greatly amplified. And it works excellent for, we'll say, up to moderate arthritis, so not typically end-stage severe, and most tendinopathies, unless, again, they're more severe, like a large tear. And after 1 to 2 months, a lot of people are feeling a lot better, especially coupled with the lifestyle changes and importantly, strengthening of the tissue in that area.
Can you give me an example of somebody who came in and got either stem cells? I mean, you did give me the example of the marathon runner. Any other therapy that you can give us an example of somebody coming in and kind of, obviously results vary. So this isn't saying that this is what everyone would experience, whatever it is you come up with, but somebody coming in and knocking it out of the park, and who also took care of the other components, which is lifestyle. They did everything right. And like, give us an example. Could be shockwave, could be laser, the PRP, stem cells. One more example of
Well,
good
we
results.
were talking about PRP. I had a few cases like this, actually, of patients traveling to Europe in particular, because there's a lot more walking there, or the activities that they had planned involved being on their feet a lot more. And a certain patient is coming to mind that was beginning to develop symptoms, arthritic symptoms in the hip. And yeah, they could still walk, but they couldn't go very far. And this was an anniversary trip with their spouse, and they've been planning it for over a year. And suddenly there's pain, and they're looking at, well, in 2 months, I'm going to be in another continent. I don't know if I'm going to be able to experience all the things I wanted to experience. So certainly not enough time for something like surgery, but a few months can change uh, the way someone is feeling pretty dramatically, with more of a biologic solution, a regenerative medicine solution like platelet-rich plasma. So we did an injection into the hip joint. It gets a little sore at first, but then pretty quickly they start to see within a couple weeks they're doing a lot better. And in this patient, they were able to go on the trip and not even think about the hip. They just enjoy themselves, enjoy their spouse, celebrate the anniversary, and then come back with excellent memories. And I do wish that I could help everyone. It's worth noting that, yes, not everyone, but the percentages are pretty good, using the concepts of the body healing itself and amplifying what the body is capable of with these regenerative medicine techniques. But there is always the homework. There's always the patient's participation. And with their help, it's hard to treat someone in spite of themselves. But usually the people who come to me are pretty motivated. And you can have really significant results that are long lasting.
I find it really interesting to see that what people do, how much it matters what you do to increase your ability to heal. This movement away from taking just essentially a chemical compound, a pharmaceutical, for instance, and having that be the only thing that you're told can help you, which I have experienced firsthand in various ways in my life, where it's like there's a very cultural mindset that this intervention that's being done, usually to you, is the thing. And when we synthesize and we test drugs, pharmaceuticals, the whole goal is essentially to make it work the same across all populations, that's the goal, right? We try and have the highest cure rate, whatever, across populations. And there's not really a consideration of what the patient does to influence their outcome. And that's not really something that's done that says, hey, take this. But if you do, by the way, when you take this, if you do these other lifestyle factors, you're going to increase the impact of this drug by 30%, or whatever it might be. That's just not studied. Those are not. But the thing is that that's likely real. So such that whatever drug that you're taking, the state of the body at time of, when you're taking it matters, and it's going to impact how much of it you might, your tolerance level, your absorption level, that kind of thing. Now with PRP, you and I talked about the fact that it matters what you do. There's some research, right, on uh, what you do to enhance that. So I guess share with us about that and any other things. Like, let's say somebody's wanting to come in and they're going to do some PRP or something with you, and like, what can they do lifestyle wise to make it biggest bang for their buck, I guess, for lack of better terminology for it.
It is helpful when patients are living what I guess I would consider generally a healthy lifestyle. So that would mean avoiding processed foods, avoiding or at least limiting alcohol, smoking, consistent exercising, um, being well hydrated. There's a number of things that can kind of increase the quality of the platelet-rich plasma. And that's just talking about the blood draw. After the procedure, those things become even more effective. One is not getting in the way of the processes that are being started. So avoiding things like anti-inflammatories, really all kinds of anti-inflammatories. I even advise people, in the supplement realm, if you think it might be anti-inflammatory, just in case, even ice, try not to use it. And that's how we know, that's the things we know we can do to create a better quality platelet-rich plasma. I think interesting is going to be in the future, the things we learn to predict and enhance outcomes even more. How do we make individualized platelet-rich plasma, not just concentrating it, what we get, taking it, sure, concentrating it, but how can we adjust it in the lab? But for the patients themselves, if they're willing to take some degree of responsibility, most of them do quite well. But if they are eating a pretty poor, highly processed diet, they're mostly sedentary, they're regularly consuming alcohol and smoking, they can still have good outcomes, but not to the same degree.
Can you actually see visibly? Can you do a draw on someone and be like, wow, look at those platelets, or man, we got to work on the lifestyle. These platelets aren't too shiny. Can you visibly see it? Is that something you can actually see?
Yeah, but not with my setup. No, that would be very nerdy laboratory setup.
See, that's like that's my that'd be my jam. I'd probably waste a bunch of money on that.
That would hit home. You could show somebody very obviously, look what you're doing to yourself.
Yeah, look at these platelets. They're just screaming for some attention.
Shame.
How about what do you know about peptides? Are you interested in ever using those? Do they help? Are they? You don't use peptides currently. That's right? Or
That's right.
Yeah. Okay. Do you know? Are there any synergistic? Have you read any research on any synergy with like supplementing with peptides? Do they help stimulate any further growth in the or any activate any platelets further? Or do we know that? That's probably too early to know. Maybe.
I think that's the bottom line. Yes, much more research is needed on one, effectiveness, two, safety. I think that's the biggest one. Safety. Data is just very limited. I worked with a number of patients who use various peptides. That in my space, the musculoskeletal space, they've been using them for many years, and paired with regenerative medicine, it does seem to have some sort of synergy with certain peptides. And I haven't seen bad outcomes. It's just really a theoretical, the what if game. And I look forward. I think now we're going to be able to do more research into those types of things. Peptides are also proteins, and they work in the same way we've been talking about signaling as really more kind of designer signaling. How can we have this specific effect and not these negative effects? I think that's likely going to be a big part of medicine in the future. And pairing them together is going to be important. And some people do that on their own, and they've been doing well. So I can't say a whole lot on it, but those are my thoughts.
I think we're going to have AI. AI will probably in the years to come be able to model some of these, and then the experiments will be ran where they'll go off and test the suggested model, the suggested framework, the suggested protocol, and we'll more quickly have resolution to does this work, does it not? Because we aren't going to be scanning through an infinite set of possibilities. AI will help us narrow down what should we try first. That's what I think. All right, let's talk quickly about insurance, and then we'll get wrapped up here. So, in reality, insurance is painful for everyone, practitioners, clients, patients alike. We all are in a system that isn't amazing, but that's a sticking point for a lot of people. I guess, what, in your opinion, do you have to say on insurance? I know you're a cash-based business. What's your kind of like stance on insurance?
And insurance is a difficult topic, and it's not a great system. It's not really a patient forward system, I suppose. I would say more of a business model rather than anything else. And in my situation, unfortunately, insurance is not covering a lot of these regenerative techniques. I do think that in the future they will, but the tendency is to lag behind maybe 20 years and require a enormous amount of research. And even when you can use something, you can only use it for, say, one specific indication, like knee arthritis or shoulder arthritis. It's very specific in that way. So unfortunately, it's hard to treat people when another entity is telling you the tools that you have. You can only use these things for these situations. Okay, do the best you can. And that doesn't lead to optimal outcomes by any means. And, we like to think that if insurance would cover some of these things, that even from their business model perspective, they'd probably come out ahead. They'd prevent a lot of things that they do end up having to pay for in the future. But currently, it's just kind of a disappointing system.
Yeah, it is. I'll quickly tell a story just because it's super crazy relevant here. My son had a bacterial infection when he was in his teen years, and maybe I've told the story, but it's worth telling again because it's exactly this point. He got treated with metronidazole. It's a powerful antimicrobial. It worked, but then what happens is, as we know, if many of the listeners will know, antibiotics will often kill off the whole. It's like a nuclear bomb going off, right? So everything gets destroyed, but then you've got lots of opportunity for pathogenic bacteria to creep back in. And that's what happened. So then he actually developed a C. difficile infections, aka C. diff. For those that don't know what C. difficile stands for difficult to treat. It's a bacteria that's often seen in hospitals. You don't want that one. You'd like to not have that. Well, if you have a weakened immune system and you have that, you really don't want it. So anyways, I did some research on this, and I found that fecal transplants were 95% cure rate, like outstanding, just like remarkable cure rate for infections like this. The insurance protocol, the standard of care protocol that is that insurance requires is that you must treat with vancomycin 3 rounds before you're indicated for a fecal transplant. So my son had C. difficile, and we treated him literally vancomycin, wiped it out, right? But guess what? It came back. Vancomycin, wiped it out again. Guess what? It came back again. Vancomycin, wiped it out. Finally, he qualified for a fecal transplant because it came back. Maybe it was the 3rd time. I don't remember exactly. But anyways, it came back. And finally, the fecal transplant was curative. Finally, which makes sense at that cure rate of 95%. Vancomycin was like 40 or 50 or 60. It was like a lot worse. And the point of the story is that, well, what happened was he actually then developed ulcerative colitis. And my thought is that his system had went through metronidazole 1 round, 3 rounds of vancomycin, and finally the curative fecal transplant. Now, you could either say one of 2 things. The fecal transplant caused his system to freak out and give him ulcerative colitis, or the overall trauma of all of this combined. And my thought was it was probably the over treatment with vancomycin. And anyway, if I were a doctor and I was looking at this, I'd say I wished I would have just been able to treat him with a fecal transplant, because the cure rate is double, maybe triple that of the standard protocol, which is really dismal and very powerful. And anyways, it's a personal story, but it highlights the way that sometimes a physician might be handcuffed to a protocol that may or may not make sense depending on the client or the patient in front of them. So we don't need to drone about that. Any reflections? I guess you'll probably just nod your head and say about right, maybe.
Well, it is a shame when medicine becomes more of an algorithm rather than an art.
Perfect.
And even physicians who take the oath of do no harm, they can't even uphold that oath based in the set of rules that they have to play in.
Well, that's perfectly said. And I would also add to that is that with AI, for better or worse, the algorithm is probably going to be, the idea of it being an algorithm is going to be perfected. That will maybe serve some better, and others will lock them into something that's even harder to get out of. Anyways, I don't mean to be negative. I feel like I'm really being negative here. But I like the idea of it being an art. I like to keep it that way. I'd like people to not be so seen as something that's robotic and algorithmic. We have plenty of that already. So, well, I'm happy. Anyways, I am happy that you're doing what you're doing, that you're allowed the flexibility because of the model that you have. And it's why I have you on the podcast, because I want to see and make sure that you're as successful as you absolutely possibly can be. You helped me, and I know personally people that you've helped as well. So I just really love the work that you're doing. Speaking of which, for somebody curious about your work, what's the next step? How do they find out about you? What do they do?
Simply reach out to the office. Again, Asheville Non-Surgical Orthopedics. You can find our website at AshevilleNSO.com. You can certainly find us through a web search. Really just give us a call. It's not an office that requires a referral, and we'd be happy to try and help anyone who's looking to, get through a difficult time or condition.
Awesome. Well, I continue to send people your way, and thank you for your time. Really appreciate it. You've been listening to the Wellness in Asheville podcast. To learn more about Dr. James Pinkston and his work at Asheville Non-Surgical Orthopedics, visit his provider page linked in our show notes. Follow along on Instagram at Asheville NSO or connect with the practice on LinkedIn. If you've been living with pain and wondering whether there's an option beyond surgery, this is a great place to start the conversation. Thank you for listening. You can catch the next episode while watching the sunset from the Grove Park Inn, wandering through Pack Square, taking a quiet morning walk through Biltmore Estate. You can check out more Asheville wellness news and events and join our newsletter at bewellasheville.com. And as always, thank you for being the best part of our wellness community. And until next time, be well.